Oh, okay, well, it is 7 o'clock. Do you want to wait a minute for anybody else, or should we just get going? Let's just get going.
Let's get going, Jeff.
Yeah. Okay, so let's call this meeting to order at 1900, and I'll stand for the flag salute. And I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Very good. Okay, are there any changes or additions to the agenda? Okay, man, my computer. Okay, real quick. There we go. There we go. Now I'm working. Yeah. Oh. Nice. Okay, so no changes or additions. So I would consider a motion to approve the consent agenda as
So
presented.
moved.
Second.
Okay, moved and seconded. Any discussion? Okay, seeing and hearing none.
I
Well,
would
go
like
ahead.
to say that I'm very grateful for Marie Botcher and the time that she has served, and I wish her a happy retirement and hope that she has a great time enjoying the next few months with her family.
Very good. Okay, anybody else? Okay, then all in favor, please signify by saying aye.
Aye.
All right, any opposed? All right, the consent agenda is passed. So we'll move on to reports and presentations. And there we go. So Dr. Chen is next up. And you'd like to unmute yourself there, Dr. Chen. We'll welcome you aboard. Thank you for coming tonight. And Creston, you want to kind of take over the
I would be
topic here?
happy to. I would be happy to. Dr. Chen, thank you for joining us remotely. This is our new norm. So thank you for your partnership and for your willingness to come this evening to kind of talk through the metrics, the information that you have shared with the superintendents. I recognize that tomorrow you're also on with all of the Pierce County superintendents. So thank you for attending this evening. One thing that we had made a decision on most recently was to become 100% remote, starting remote, and then just identifying a small population of students to come in. And we're looking at that right now with our special education population. Ms. Blaskowitz, Kristen is working through that. But thank you for joining us, and I hope that you received the questions that my Secretary Debbie had sent on to you and your staff, and really open it up for the board to have a dialogue with you about maybe what our future looks like, what we can anticipate, and what the trends look like. They're better than last time you and I had spoke. So welcome, Dr. Chen.
Great, thank you. Can you hear me okay?
Yes, absolutely.
Mm-hmm. Yeah, so would you like me to start with the trends, or you want me to dive right into the questions?
I'm going to allow you to do whichever you see fit and the more pertinent information.
Okay, great. So, you know, I know that this has been a very challenging time for you as a district and as a board, and certainly, you know, I've spoken with Superintendent Barr several times. And so just want to acknowledge that and, you know, recognize that we're in a very difficult situation. We obviously would like to be able to, you know, get the students back in in-person learning as soon as possible. But it's when the superintendent spoke with me back in July, they wanted to know whether it was going to be safe or not to do that. So we had to make a call, you know, a month or two ahead of time just to make sure that all the schools would be able to prepare whichever way they were going to go, you know, whether it's going to be remote or open for in-person. I think, you know, just to be clear, there are two issues. One is, how do you do it once you open, right? You know, when it's safe to open, what do you need to do? And that, I don't think there's a lot of concern about. You know, OSPI, Department of Health has guidance. I think pretty much all the schools, whether public or private, have good plans in terms of, you know, spacing kids 6 feet apart, wearing face coverings. Of course, there'll be challenges with trying to fit all the students on campus in the classrooms because of space issues. But you know, my staff have worked with all the schools, and you know, we feel pretty confident that they have that under control. The second question really is what I mentioned earlier, which is it safe to bring the students back for in-person learning? And if you remember back in July, we were on a really rapid and you know, honestly, it was scary to me, but upward trajectory in the number of our cases. So just to give you a little background, there's several numbers that we look at, and this, I think, addresses your first question, by the way. So one of the things that people pay attention to is how many cases we're getting per day. And to give you perspective, at our peak in April, if you remember, that's when everyone was stressing out. Our peak in April was about 77 cases. Took us a while, but you know, everyone stayed at home. You know,
Dr.
really.
Chen,
Yes.
Dr. Chen, I hate to interrupt you. Jeff Lucas, could you mute your microphone?
Yeah, I'll do that. I'm not making
Awesome.
any noise, but
I will do mine as well.
let's see.
Great. Is that better? Yeah. Okay, good. So just give you some perspective. Back in April, our peak was 77. You know, it took us a long time. It was pretty stubborn. We hit a couple of plateaus, but we were able to get it down to about 10 cases a day. So we were feeling pretty good about ourselves. And then we decided to move to phase 2. And unfortunately, when we moved to phase 2, I think everyone forgot what they were supposed to do, right? So we had a lot of people just kind of rush out, lots of, especially young people, you know, gathering in groups. I mean, that's what 20-year-olds do, right? I mean, they get in their car, they go hang out with their friends, they have barbecues, they go to the lake or the beach or whatever. And they really were the point of the spear. There's a huge increase in the 20-year-olds. And guess what? In less than 2 weeks, our cases started heading north. And this was really surprising to me. I thought we were going to be able to do better. So if you remember, we had been at a peak of 77. We got down to about 10 a day. At our peak a few weeks ago, we were up to 120 cases a day, which was just, you know, it was scary. And we were starting to see the impact of this widespread community spread, right? So businesses, so if you remember, like hardware stores or certain grocery stores, certain businesses were allowed to stay open the whole time because they're essential. We started seeing cases in them. Not that they did anything different, right? They were still doing all their hygiene, face masks, you know, all that kind of stuff. But there's so much infection spreading around the community. Either people were bringing into their businesses or their employees are going home and getting infected, and then they'll show up at work and then they would report to us that they had a case. We were seeing them in, you know, just about any kind of business you want to name, small, big, right? We were seeing them also in actually doctors' clinics. We were seeing cases in childcares, just about everywhere. So that's to give you an idea. One of the numbers we're looking at, cases per day. So today we reported 44, which is a big relief, right? I mean, we're down from that peak of 120. Another number that you're going to hear a lot, which is one of the metrics that the state is going to be looking at, is if you took the total number of cases in 14 days, added them up, and then you divide it by the population and express as a rate per 100,000, right? So we've roughly, 900,000 residents in our county. So to give you an idea, the governor's Safe Start plan says when you move from one phase to the next phase, you should aim for 25 per 100,000. Okay, so keep that number in mind, 25 per 100,000. At the end of May, when we applied to go from phase 1 to phase 2, we were at 16 and we were feeling pretty good, right? We were below that 25 per 100,000. At our peak a few weeks ago, we hit 149. Okay, so fortunately, we have now come down and we are, let me see, where are we now? I think we're 50 something. I'm sorry, I think we're 84, 85, something like that. Yeah, we're at 85. Today we announced we're at 85 per 100,000. So remember I said, remember 25, and then there's another number in the Department of Health decision tree, which is 75, right? So we are within striking reach of 75. If you think about in July when the superintendents asked my opinion of whether we thought we were going to be safe or not, right? So that was before we hit the 149. So clearly we're on an uptick. We were not within striking distance, and they actually had not released this number of 75 yet. When they announced the number, I believe we were around 120 or something per 100,000. So the fact that we have now come down to 85 per 100,000 is very positive, right? So we are now within striking reach of 75. And so what the decision tree talks about is when you're over 75, that's really high community spread. And so right now, that's our situation. So what I have told the school districts and the private schools is they should not open. It's just not safe. It's looking a lot better now than when I first told them that in July, but when we have so much community transmission, what will happen is it will get into the schools, or parents will get exposed to it, or the kids, when they're not in school, will get exposed to it. They're going to bring it to school. So of course, we have to worry about the health of the kids, the health of the teachers and staff, and the health of the parents. That's one thing. The other thing is, remember what I said about the 20-year-olds, right? We're all connected. We have now seen the 20-year-olds have spread it to the 30-year-olds, have spread it to the teenagers, have spread it to the 40-year-olds, right? We're all connected, and when people start getting sick and they're moving around the community, they will get other people sick. So if kids get exposed and get sick in school, they're going to go on the community. They're just going to exacerbate the whole community situation. So that's what we're really concerned about. But when the levels are above 75 per 100,000, schools are allowed to bring back in small groups the highest risk learners. And I know Superintendent Barr has shared that with me. And these are, of course, the students who have the highest needs, the ones who may be living homeless. There's kind of a list of them. And what we have to decide, because it was a little bit vague about what this small group was, we have kind of set this limit about 5 learners per small group. And that's consistent with our phase 2 rules, which kind of say, you shouldn't have more than gatherings of 5, right? So that we had to set a number. That's how we justified that number. So that means, of course, you can have a teacher in addition to that 5. If you need another staff member, I know Superintendent Barr, you had mentioned to me that just some people who have physical disabilities, they need assistance. Sure, you can have a teacher and 1 other staff member with your group of 5. Okay, so what happens when you drop below 75 per 100,000? At that point, you can consider bringing back elementary kids. Now, of course, so Superintendent Barr, you're getting a preview of tomorrow. One of the things I'm going to ask the superintendents tomorrow is, how should we phase this back in? I'm sure no one wants to rush and have thousands of kids all of a sudden starting school again and then find out a week or two later that the cases have gone back up, right? So, and just logistically, I'm sure that no one is ready to turn on a dime and flip the switch and say, oh, we're no longer doing remote, we're going to bring all these kids in, right? So we are going to have a conversation among the private and public schools, like, are there people, for example, who want to go first? Or, you know, we probably should do this in some kind of staged fashion, but that's a conversation that we're going to have with our educational leaders. So that's the really positive spin on it now, which is we came off a really scary high peak. We are now within striking distance of 75. Even if we don't get to 75, school districts and private schools have the option of bringing back small groups of learners, the highest risk. We are going to be working, and again, Superintendent Barr, this is a preview of tomorrow. One of the other things we'll talk about is everyone's really concerned about social emotional learning, mental health, right? There's no good way for us to deliver that remotely. So we would like to get some experts together and talk about what is the best, you know, what's the state of the art for us to be able to screen for people who are at risk. What's the best way to try and deliver them some services? How do we best create a network of resources for students and their families so that we can support that until we can get kids safely back in school, okay? So even if we drop below 75, remember, school districts and private schools can think about bringing back elementary school kids. They specifically say, see how it goes. And, you know, we probably will be talking about maybe waiting 2 weeks between moves because that's an incubation period for COVID-19. And then if everything's going well and people are ramping things up, then you can think about bringing back your middle and high school kids on a hybrid model, okay? So that's in the 75 to 25 range. And then if we can drop below 25 per 100,000 in 2 weeks, schools can think about bringing everyone back, okay? So that's, I've covered a lot of ground. I've given you the numbers, the background, as well as the general decision-making framework that we'll be looking at in the next few weeks.
So Dr. Chen, thank you. I think that sets the tone and that aligns with our plan that we have submitted through OSPI. I'm sure that the board members may have some additional questions. Did you receive the specific questions from them prior to? I know there were a few questions, Dr. Chen. If not, we can just open it up for the board members if they have.
I'm sorry, I was muted there for a second. Yes, I did. Thank you. It's very helpful. I think I answered most of the first one, which is the detailed metrics. The only other metric that you need to pay attention to right now, as we're looking at that 75 number, is that the state also specifies that our positivity rate needs to be less than 5. And what that reflects is that, you know, if we are not testing enough, the positivity rate can, I know you've heard a lot of conversation nationally about, are we testing too much? Are the increased numbers just because we're testing too much? If we are testing more and the positivity rate decreases, it tells us that it's just from testing more, or the disease is getting less, right? But if we're testing more and the positivity rate is going up, it means there actually is more disease, right? So what they want to see is as our cases come down, our positivity rate also comes down, telling us the disease is spreading less. So when we went to phase 2 in June, our positivity rate was around 2. It got up to around 8. I think it was hovering close to 9. And then kind of settled more around the 7, 8 range. We're down to, I believe, 5.5. Okay, so really good sign. Okay, our total numbers are down. Our case rate per 100,000 is down. Our positivity rate is down. So this is all consistent that people are doing a good job. They're wearing their face coverings and masks. They're paying attention to how much traveling they're doing, how much they're gathering, so on and so forth. So that's a really good sign. So I hope that, I mean, if we're at 5.5, that in a few weeks or whenever we get down to 75 or 100,000, I'm hoping that our 5% will drop, that will drop down to 5%. Okay, so literally we are within striking range. Okay, so your second question, do we need to have vaccine before we return to in-person instruction? No, we're not making that assumption. In fact, everything that I've told you in terms of Department of Health guidance assumes we do not have a vaccine. Entirely public health measures, right? So stay at home is a public health measure. Wearing a face mask is a stay-at-home measure. When you are able to bring your kids back and they're sitting 6 feet apart, wearing face masks, they're not eating in the cafeteria, they're eating in their classrooms, so on and so forth, public health measures. We're not assuming there's any vaccine. We have no idea when the vaccine is going to show up. Some really optimistic people think by the end of the year. I think most people think it's probably going to be beginning of next year. And even when we get it, you know, I don't know how many of you remember when we had H1N1. The advantage there was it was a flu vaccine. We knew how to make flu vaccines. We just had to tweak it. However, once it showed up, remember, it was chaotic because everyone wanted it. We didn't have enough. So we had to prioritize. We had to figure out how we got it out. You know, we, in Pierce County, we delivered it through pharmacies, and we didn't have a whole lot of mass immunization sites. We did some sites in collaboration with schools, you know, so on and so forth. But we do not anticipate, or at least I'm not anticipating, that by the end of your school year, you will have all your students immunized. I just don't think it's practical. I don't know when the vaccine is going to show up, and then there's going to be an issue that all your students and staff are going to be competing with, you know, the other 900,000 people in the county who want the vaccine, okay? So we are operating right now on the assumption we don't have the vaccine. There is something else you guys can do, which is we do have a flu vaccine. Okay, so let's be clear here. Flu is not the same as COVID. However, flu and COVID have very similar symptoms. Okay, so just give you an idea, back in, I think it was April, you may have read, you know, we did a testing at the Tacoma Dome with FEMA. You had to have fever, symptoms, and you had to either be in a high-risk category or be a first responder, essential worker, whatever. So pretty high bar. And we did it for a week. It sold out in 3 days. You know, 98% of the people were negative. Only 2% were positive. What that tells you is 98% of people had fever, cough, sneezing, whatever, from flu or some other virus. Okay? So the recommendation for flu shot is everyone over 6 months of age should get the flu shot. Now, the senior citizens have an extra strength flu vaccine. We would encourage them to use the extra strength, but basically everyone who does not have a medical contraindication should get a flu shot whenever it becomes available this fall. And that is so that you don't have kids showing up at school with a fever and you send them home because you think it's COVID and it's really the flu, okay? I mean, of course we don't have a vaccine for all the other viruses, but if we can cut out all the people with flu, it just will make everyone much happier, right? Parents would be freaking out because the kids, they don't know what to do with the childcare. They think they're going up to quarantine for 2 weeks, whatever. Everyone should get the flu. That's just to keep the infection rate down. Everyone should continue to wash their hands, cover their cough, wear the face mask, because we have seen in the Southern Hemisphere, the flu season is milder because everyone there is doing all this for COVID. We never used to do that for flu season. You know, they do in parts of Asia, but not in most of the Southern Hemisphere and not in the US, but we're seeing encouraging signs that that is helping with the flu outbreaks, okay? So we need to continue all the public health measures. We're going to operate that we don't have a vaccine, okay? Is there a plan to deal with large number of parents who refuse the vaccine? Oh boy. I'm not sure what your exemption rate is in Eatonville. My recollection was it was pretty low. Wasn't it around like 5%, 10%, your exemption rate?
Yeah, Dr. Chen, it seems to be very regional. In
Mhm.
certain areas, we have parents that really do not either believe in vaccines or wish to have their child have vaccines. So
Yeah.
our exemption rate is right around between 5 and 7.
Yeah, and I remember it used to be higher, and because I remember, you know, we were able to get a grant and work with your nurses, and this was years ago. Actually, it might have been just before you started or just after you started. But I mean, you guys are actually doing pretty good. I mean, compared to places like Vashon Island or, you know, up in the northeast corner of our state where there are a lot of people claiming exemptions. So you guys are doing pretty good.
Right.
So we are going to need to have some conversation among the health officers in the region about what we will do with that. Okay, so, and as I said, it's not actually going to show up for a while, so we have a little time to make that decision. I think one of the things we are worrying about is a lot of parents are not taking their kids to go see the doctor just because they're scared to be out during COVID and they don't want to be sitting in a doctor's office with sick people. And so kids are falling behind. So I know that normally you do outreach to your families about making sure they're up to date on their shots. You need to work extra hard at that. And, you know, on our website, there is a listing of some places to get immunizations. I think your pharmacy in town, I know they give flu immunizations. I don't know if they give kids immunizations. But, you know, let us know if you need help getting immunizations to your kids. But we just need to remind parents that we're still expecting them to get vaccinated, even if you're starting remote. And of course, I mean, it's no different than summer break, right? If they don't do it and then all of a sudden you open, then there's going to be a big rush to try to get into the doctor's office. So they just need to plan ahead. We certainly don't want a measles outbreak or a pertussis outbreak on top of COVID. But we will keep you posted about what the health officers decide about how to address people who are refusing vaccine.
Thank you.
Now,
Dr. Chen, there was just yesterday, there was a Department of Health and OSPI school vaccine requirements, distance learning during COVID document that came out that really kind of addressed that as well.
Okay, great, great. Well, good to know we're all singing off the same book, right? So, okay, your next question. Is there a plan to deal with the large number of parents? Oh, I'm sorry, no, I'm on the next one already. If vaccines are mandated, do you anticipate proof of natural immunity in the form of titers? No. Normally, we don't require that for vaccinations, but also right now, we don't know what antibodies mean. You may have read there just was a report where they actually were able to confirm the first case of someone who got COVID-19 twice. The only reason they're able to do that is they isolated the virus and by genetic analysis found that they were different, okay? There have been other reports of people who may have gotten it twice. We just haven't had as solid evidence that the person got infected twice. If you, well, actually, you may be aware that coronavirus includes the cold viruses, right? So if you get the cold, you could get it again the next season. You may not get it the same season, okay? So what that means is we still do not know how long lasting the antibody is to coronavirus. None of the vaccines have completed full trials. We know that several of the vaccines can produce immunity that protects you at that time. We don't know how long that immunity lasts. And normally when we create vaccines, we have years to do it so we can test it and keep testing the kids year after year, or every 6 months or whatever you want to do and find out how long it lasts for. We will not have that opportunity with coronavirus or COVID-19, okay? So first of all, we normally do not require people to show immunity except sometimes, like, you know, if kids show up and say, hey, I know, or the mother says, I know they had the shot, I lost the records. And then sometimes we'll say, okay, if you rather do a blood test and show immunity, we'll do that. But then those, we all know what the antibody levels mean. Okay, so I think I've discussed enough about that. Next question, emphasis on equity. Boy, this is tough, especially for districts like yours that are rural. I remember your former superintendent telling me, yeah, we call school off early for snow because we don't want kids waiting out there 4 a.m. because there are cougars around. And it's like, oh, okay, that's right. You got cougars and bears. You know, Tacoma doesn't have to worry about that, right? And I also know you have schools that are very dispersed and far apart. So yeah, I know that. And actually, I think some of these issues here, Superintendent Barr, I think we addressed since we talked, right? I mean, because you're talking about whether you can bring back those with special needs and, you know, not just learning needs, but those with pressing social needs. So I think
Dr. Chen, I would agree. I would agree.
So I think we're okay with that.
Yep, I think we're fine with that.
Yeah, go ahead and bring back the groups of up to 5 kids. Uncertainty is difficult for families. Do you foresee any chance of return to a classroom? As I told you, I'm feeling a whole lot better now than I was in July. I think we're within striking distance. I think there's a good chance, and that's why in my letter in July, I encouraged everyone to continue planning for hybrid learning and to plan as, you know, and be ready if we can bring the kids back. Are we going to get a big surge again later in the fall? Who knows? It's very possible that it might rise again to a level where we don't feel it's very safe for kids to be back in-person learning. But, you know, we always plan for the worst, hope for the best. And right now it's looking like we might be doing okay. And if we can sustain this downward movement, and if we start having some schools be the leading edge and we test it out and it works out fine, then I think we'll be good. Okay. In order for parents to go to work, many will need to put their children in childcare. Is it safe for children to be in childcare? Why is it not safe for them to be in school receiving an education? Boy, this one is a difficult question. Well, I shouldn't say it's all difficult. The first part is easy, right? Parents do need childcare, you know, so unless you're lucky enough to have a spouse or a grandparent who can watch the kids for free, or, you know, you've got kids who can behave themselves and your job lets you work remotely, you need childcare, right? And so, I mean, this is such a difficult situation, right? We need parents earning a wage so they can keep food on the table, they can keep a roof over their head. We don't want people losing their jobs. We want kids to learn, and we know that remote learning is not ideal, right? But we're having to do a lot of compromises right now, and hopefully they're temporary. One of the challenges for us is, you know, it depends how you want to prioritize. I've had some parents kind of email me or call me and say, well, why are childcares allowed to open and you're not letting kids go back in school? You should just shut down the childcares. It's like, no, that doesn't work, right? I mean, that's going to put even more parents in trouble. Part of what is difficult for the public, and I fully appreciate this, is that the governor and Department of Health has created different rules for childcare, right? So they're allowed to have groups of up to 20. Right, and so then parents are saying, well, why are you not allowing regular kids back, but you're only allowing special needs kids and homeless kids back at groups of 5? Well, unfortunately, it's this slippery slope the governor has to operate under, right? I mean, churches are allowed to have even larger groups of people, but, you know, there was an argument to do that. Child cares, as I said, there's clearly an argument for having childcare so that parents can work. So what we are going to be doing, boy, Superintendent Barr, you get all these previews of the meeting tomorrow, right? So there's this.
Hey, you're just, you know what? You're just warming up.
There's this issue about some schools have ECAP, preschool, and so on. And so do we treat them like childcare, so we treat them like classes? Okay, so we're going to have a conversation tomorrow about that. And we think that in terms of equity, it makes sense for us to allow schools to declare them as childcares, right? It makes no sense to say, you know, you can have a freestanding, you know, preschool and they get to have 20. However, if a school district's running a preschool, then we have to cap it at 5. It just doesn't make sense. Now, of course, I still have to face the people who say, why are you letting the preschool ECAPs go back at 20 and you're not letting my first grader go back in a class of 15 or whatever, you know, or in private schools might be a class of 8 or 10, right? So this is a difficult situation, and you know, Department of Health and DCYFS and the governor, they've all drawn various lines, and certain things have gone regulated. And the reason they've done that for child cares is they've declared child cares essential, and the workers who work there are essential workers. Okay, so they got a different set of rules. Hard for me to defend it one way or the other than to say that's what we have to deal with. And again, it's really not about we're discriminating against schools and kids. It's just we have to make these difficult decisions. Are we going to let parents go to work? You know, and so that decision was made. Your next question, while Eatonville is part of Pierce County, we are unique because we're a small rural community. Will there be any consideration given to our local COVID matrix and our ability to provide in-person instruction due to our smaller student population? I get asked this a lot, and you can imagine the private schools ask this even more. And your neighbor close by, right, Carbonado, right? They're smaller than some of the private schools. So we get asked this question. This question also has come up in the past about, you know, several municipalities in our county have asked whether they can move to phase 2 before the rest of the county because there were lower rates. I appreciate people paying a lot of attention to our website and our data, but I need to explain a few quirks of how our data is collected. First of all, our data is collected entirely by where you live, okay? Because we figured that's the best way to do it. And that's the most consistent way to do it. When we were investigating some of our business cases, for example, like several of the employees might have been from King County. The agreement is they get counted in King County statistics. So they show up in whatever zip code or census tract in King County, even though they're spending 8, 10, 12, however many hours they're working in Pierce County at the business. Okay, that's just how it is. So yes, it is correct that we have several rural census tracts where the numbers are quite low. Okay. Not universal, right? So there are some more kind of rural, semi-rural census tracts that have relatively high numbers. So it's not universal, but in general, we do have several areas that are more rural that have lower numbers. The second thing, if you remember what I just said about the business, think about the flip, right? Because there's not as many businesses in rural areas, many of those people are driving to urban areas to work. You know, I've gotten messages from parents in some of these districts who say, I need to go to work in Auburn. I need the childcare for my kid. Why aren't you opening my child's school? And that parent just answered his or her own question. Because you drive to Auburn, you could be exposing yourself, and you bring it back to your community. You could give it to your kid, and we know a lot of kids don't have lost symptoms. That kid could go to school, and then you'll be spreading among the kid's friends and teachers and whatever, right? So I know it's very difficult for people living in low prevalence areas and in more rural areas to wonder why they're being lumped in with big urban centers like Puyallup or Tacoma. But it's because we have a mobile society, okay? And also there's that quirk about we track cases based on where people live, right? Someone could work in like a nursing home in Puyallup and there'll be a huge outbreak there. And if they turn positive and they live in Eatonville, we count them in Eatonville, right? Or it could be the other way around, right? They live in Puyallup where there are a lot of cases, but they happen to work in Eatonville, right? So, so it's just, I know some people feel it does not seem fair. However, the reality is we are connected. And any of you who drive I-5 or 167 or 512, you know traffic is up, mobility is up, right? So you know, the state has access to traffic data. They also have access to cell phone data. Mobility is quite high. We're up at 70, 80% of what it used to be. Okay, so that's the challenge. And that's why, you know, when we had the stay home order, it was not just people in certain areas. Everyone needed to stay home. Recognizing it was a very blunt instrument, but it did work. It brought the cases down. Okay, now we're trying to have something more fine-tuned. That's why we have stood up our case investigation, contact tracing. That's why we're talking about if kids go back to school, they need to be 6 feet apart, so on and so forth. Okay, so right now I know I'm catching a lot of flack on this, but I just feel that it's not a great idea for us to allow, you know, either specific school districts or specific private schools, right? If you think about private schools, their kids don't come from a geographic area. They come from all over, right? And also there's more mobility because then oftentimes they don't have buses, so their parents are driving, you know, personally driving them to the private school. So I know it's not a popular position right now, but I hope that makes sense to you. Okay, so that was the 11 questions I had. I don't know if there's anything I asked which prompted you to think of something else or something that you didn't quite agree with what I said when I answered.
So Dr. Chen, let's open it up for the 5 board members. And if they have specific questions that weren't answered, let's do that at this time.
Okay.
Well, I don't really have a question, but just a comment and saying thank you for the metrics. You know, one of the big things that I do hear from people a lot, and I thought of myself, was, you know, we're testing more, so of course we have more positive cases. But looking at numbers, the rate of infection and then the percent of positives tested, you know, adding those together, that makes a lot of sense as to how you can actually track positive spread or community spread. So no, I just appreciate knowing the exact kind of the formula that's being looked at.
Mm-hmm. Okay. Yeah, I'm glad that was helpful.
Dr. Chen, building off Matt's question or response, I'm curious about your take on the most recent CDC release the last day or so about testing. Do you think that that will change any of the testing numbers, or is that not going to change Pierce County at all?
I think you may have seen in the news, it originally it was kind of slipped out as there was a kind of abrupt change on their website. And since then, there has been reports that this was actually due to some political interference. It's very unfortunate. We have seen this. You may recall the CDC had issued some guidance in the, you know, some months back in the spring about when states should move between phases. And then that was blocked and, you know, rewritten. And so I'm going to be having a conversation with our regional health officers. We believe the recommendation is incorrect and should not have been issued. So for those of you who didn't see in the news, what it was is, currently, if you are in contact with someone who is a case, right? So when we do our case investigation, and someone says, I was, in this bar, or I was a teacher at school, and these are the other faculty members or staff I was in contact with. So we contact their contacts, and we say, and we don't necessarily tell them who they were in touch with, but we say, look, you've been in contact with someone, you should go get tested, regardless of whether you have symptoms or not. Okay. And this has become really important because we have increasingly seen that people can be asymptomatic and be positive. And there's also has been some research that's come out that says actually the time you are most infectious to other people may be a day or two before you get symptomatic. So what the new guidance said was if you're a contact and you have no symptoms, you don't need to get tested. So this is clearly contradictory, or in contradiction to our level of understanding, and it would take away a really important public health tool for us, right? Because what we do is if someone has been in contact, we say, quarantine yourself and get tested. And then we need to see if you got infected or not. And then we want them to wait, it might be 14 days and see if they get symptoms, right? But at least they were tested, and we know that if they don't have symptoms, the likelihood that they were infected is very low. Okay, so we believe this new change is incorrect. But I'm going to talk with my other health officers to see if we will come out with an official statement on that. Superintendent Barr, I remember, this is for a different reason, but you probably remember back in the spring, there was an issue where the CDC website had a mistake on it. They updated one part, they didn't update the other part. The Department of Health and health officers felt that you didn't need to do this part. So we did issue a letter, if you remember. So it may be something similar if we do that we would issue a statement or a press release or a letter that says we do not agree with this. We would expect in the areas where we have jurisdiction that people continue to get tested even if they're asymptomatic.
Thank you for answering that. I was worried that we were going to be changing our protocol. And thank you for releasing that protocol as well. I don't know who actually released it, but the contact tracing, and there was a good schematic for us to put on our website. So thank you, Dr. Chen, for that.
And just want to assure you all, I know that sometimes, our media markets are the same as King County. I know that in the spring, King County got kind of overwhelmed and they stopped doing contact tracing. In Pierce County, we never stopped contact tracing. And fortunately, through the CARES funding, we have trained up a bunch of people who are sitting in reserve, ready for us to activate them, do contact tracing. We are now doing, I think every day, we're reaching out to like between 1,000 and 1,200 people. And that's between cases and contacts, right? But we are prepared to do, I think, like 3 or 4 times that number if we need to. So we're ready for it. We'll run into the same issues you guys have when you try to reach people, right? People don't answer their phones, stuff like that. But we're ready to support you if you all need it.
Dr. Chin, this is Rhonda Litzenberger. I wanted to thank you for taking the questions that so many of our community members have been asking, and for your forthrightness. We appreciate the time that you've spent here with us this evening and for the work that you do, and hope that we can continue to be a partner and move this work forward so we can get our kids back in school as soon as possible. So thank you for your work.
Oh, of course. And I've told Superintendent Barr many times before, schools are such important partners for us. There's so many services you deliver, and also we as a health department are able to reach so many kids and families, right? Not just the students, but and their families, because schools collaborate with us. And if nothing else, I mean, the Healthy Youth Survey, which tells us so much information about kids, we could never have that data if it weren't for the school. So yes, absolutely, value the partnership and look forward to continuing it.
All right, Dr. Chen, before we let you go, I just want to actually ask about the 26-foot research that came out. Is that going to change our masking at all, or masking will assist with that?
I'm sorry, say that question again.
So the new research that came out that said that up to 26 feet, the aerosol, the virus can travel up to 26 feet. I don't know. That's what was on this evening's news. Okay,
so my camera's not on, but if it were, you'll see me smiling. I mean, in January, most people didn't know what public health was. Everyone knows what public health is now, right? No one knew anything about statistics or what a coronavirus was. Everyone feels like they do now. One of the real challenges is the data is very fast moving, but then media is even faster, and social media is even faster than that. I don't know if any of you are runners, but a few months ago, some engineer in Germany did some computer modeling about people running on treadmills, and he made a statement about when you run, you will exhale particles like COVID. And, the slipstream behind a runner can extend 30 feet. Social media pounced on this. I run a little bit, and one of the runs that sent me an email said, or they were saying something about keep 30 feet from other runners. That is not what the researchers said. In fact, if you read his thing, he actually said, well, people create a slipstream and it doesn't go sideways. So if you're going to run with a friend, run next to them. Just don't run right behind them. And those competitive runners, they draft. Do not do that, right? Because that's where the COVID will go. So it's similar here. A researcher said, yeah, you can, there's a lot of conversation about, is this in big particles, droplets, or an aerosol? And so he was commenting on the aerosol, and that aerosol we know can stay in the air longer. And so there's this number around it could be up to, 26 feet, whatever. And it is not going to change our 6-foot distancing. If you want to put your kids 26 feet apart, you're welcome to, but I think that's one kid per classroom, right? I mean,
that's exactly the answer I wanted to hear from you. So I do appreciate that, because I know that this will be streamed on Facebook. So we just kind of wanted wanted to address. So thank you.
Yeah, I mean, I think what it is we just have to be aware there's nothing perfect. Sure, if you could saran wrap every kid and figure out a way that you could breathe through the saran wrap, right? That will be the safest thing. But we are, we think a compromise is to say roughly 6 feet is what we think is a safe distance, so on and so forth, right? And we know some kids will not be able to wear the mask. We know that kids move around the classroom. It's not perfect. We're not going to force them to wear a 3-foot or 6-foot bubble around themselves so that they can't get within 6 feet. We're trying to reach a reasonable compromise here. And someday we might know better than that, but this is where we are. If you remember, a few months ago, American Academy of Pediatrics issued a statement saying it's so important that schools should consider using spacing of less than 6 feet. And the health officers in Pierce, King, and Snohomish all agreed that we did not support that recommendation. No one else has come out with that recommendation. And so we're continuing to use the 6-foot spacing.
All right. Well, I know that all of my answers all my questions have been given. Is there any other board member at this time that would like to ask a question or a comment?
Anybody else? Speak up now. All right. Well, if we don't have anything, then I would reiterate, Dr. Chen, thank you very much for your time. I know it is probably in extremely short supply these days. So thank you very much. And at least you didn't have to drive out to Eatonville to see us tonight.
Well, I miss doing that. You know, it's whenever I come out and visit with the superintendent, I always take the afternoon off so I can head up to the mountain and hike. But even if I don't get a chance to hike, it's just such a pretty view of the mountain from where you are. So.
It's not a bad commute as commutes go. No, you're absolutely right. So thank you again, Dr. Chen.
Thank you, Dr. Chen.
Yes, absolutely. And if any other way I can help, just reach out and be happy to do so.
We are not afraid to use your phone number.
Okay.
Thank you.
All right. Bye now.
Okay. So with that, Kim, are you set for financial report?
I think so. So we'll start with the revenues. At the end of July, we had actually caught up as far as our levy collections. So that delay to June did not end up costing us anything. Our timber excise collections are only about 50% year to date. Typically, we do see a bump in those collections in August. So hopefully we will catch up. Timber is actually a portion of our levy. So we put in our maximum levy. They carve out what they think we're going to get in timber collections. They subtract that from our levy collections. And as far as what we can collect as a district, and then the state provides those timber pieces. So it is an important piece of our levy collections. Year to date, we have actually not received any state forest money. As you know, that's why we don't budget for that, because it fluctuates so wildly. Last year we had over $100,000, and this year we've not received any at all. Food service revenue is down about $10,000 in our paid collections. So that does not include our free and reduced students. That's just our paid participation. Because of the way that OSPI and the state settled on a method for calculating lost revenue for food service, we won't actually be able to claim any of that for our CARES funding. So what they did was to look at your losses this year, your revenue to expenditures, and then they looked at your average over the previous 3 years, and whatever you had above the average of the previous 3 years, you could claim as lost revenue. Of course, we brought our program in-house this year, and they worked really hard, and participation was way up, and so we didn't have as many losses this year, and for that, basically, we got penalized for doing a good job. So we will find other ways to expend our CARES funding. We do expect to see a large jump in our federal revenues in August. We had several of the grants, Title II, Title IV, that we held off on spending until August so that we could offer additional professional development opportunities for our teachers in remote learning and in UDL in preparation for reopening. On the expenditure side, through the end of July, there really was only a slight drop in salaries and benefits. Of course, we kept all of our people on staff throughout the spring. And so the dip is really just used to our not utilizing those substitutes. And for 3 months in the spring, it doesn't make a large amount of difference. The largest decrease obviously was in supplies and in utilities. Part of the reason for supplies being down, honestly, is that we've seen some shipping delays on curriculum orders and those things that are coming in. So again, they could be more of a bump in August to offset that. I did want to point out on the July budget status, if you look at special education, it shows a deficit of 132,000. Last year, at the end of July, the deficit was 381,000. With safety net, there is actually a chance that the program may break even this year, which Kristen is to be commended. She's in shock, but bringing a psychologist in-house that she kept posting that position for years, that she was able to do that really was extremely beneficial, both for our kids and for our district financially. The interfund loan for the transportation vehicle fund is going to be paid off on August 31st. So that will be all taken care of within this fiscal year. Clay has his new buses and is going to hold off on purchasing anymore as he watches how the year rolls out and sees exactly what size type bus that we might need. Us on the technology side, I know Drew is on. We did receive all of our devices, all of our teacher devices, all of the secretarial and admin devices, and all Chromebooks came in under the wire. Carolyn is really to be commended for working with the vendors within the bid parameters that the board had laid out. She was able to work with 3 different vendors to say, this is what I need, this is my absolute need to have deadline. It turned out that we had a little bit of an upgrade in our device. One of the vendors said, I don't have the one that you asked for, but I can get you one that's a little better in that timeline. And it still came in at over 25,000 under the next bidder. So they are in and have been, for the most part, deployed very successfully through our technology department. On the human resources side, unfortunately, as you know, we did send furlough notices out to our bus drivers and our paras last week. OSPI and the governor have both affirmed in the last week an expanded list of acceptable uses of transportation funding. However, they have not changed the methodology for funding. So they're saying the funding that you are receiving now, you can use to deliver supplies, you can use to take meals, but your funding for this year is still tied to ridership. So if we can't figure out the ridership piece, you'll get funded through December, and then it's still, you would lose that apportionment from January through July. Kristen at this time has identified most of her most vulnerable students that need to be the first to be brought in. And so she'll be working with Clay to start looking at routes and how we can utilize our bus drivers and maybe even start bringing some of them back. And we did post 2 temporary IT help desk positions that we know that Drew and Byron and Tyler are going to be fielding a lot of questions from parents and students as we get the year rolling. Simple stuff like, I can't remember my password. I've changed my password 4 times and I don't know which one I use. And so we're going to utilize some of our in-house help to fill those positions. And last but not least, we did learn today that apparently there is one more step to being able to offer all of our classes in a distance program, that it was not part of the template that we had to fill up for OSPI. But before we can offer distance learning, we have another set of hoops that we have to jump through in terms of application and proof of what's being offered. So we will get that done before next Wednesday.
All right,
So,
thank you,
like,
Kim.
I would like to, Jeff, I'd like
Go
to
ahead.
thank Kim for that. And just with that last statement, I don't know that that's true. I'm going to have to check that out, because if that is being touted, that if you're brick and mortar and you're doing distance learning, then that's going to affect every single person in the state. So I am super irritated about that. And so we will see. So I just had to put my 2 cents in there, because I was sharing that with my husband and he was like, that was not part of the plan. And Chris Ragdoll has not spoken about that. So more to come on that.
Well, that 2 cents sounded more like $1.50 from here, Creston. Good. Well, and let me know if we can write our own letters to people too. I haven't done a lot of that lately, so we'll stir it up. But thank you, Kim. There's certainly a lot more good news in there than I expected. So that was nice. Anybody have anything else on the financial report? All righty. So let's move on to new business and consider acceptance of our gas and diesel bid from Associated Petroleum for next school year. So I would accept a motion to approve that.
So moved.
Second.
Okay, moved and seconded. Any discussion on the fuel bid? All right, seeing and hearing none, all in favor, please signify by saying aye.
Aye.
All right, all opposed, say nay. Okay, motion passes. And I would consider a motion to approve the bid for propane from Feral Gas for next school year.
So moved.
Second.
Moved and seconded. Any discussion on that one? Seeing and hearing none, all in favor, please signify by saying aye.
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 Opposed? All right, motion passes. So now for approval of new policy 5412, Family First Coronavirus Response Act. I would accept a motion to approve that.
So moved.
Okay, so we do not have a second.
Second.
Oh, okay. Let's discuss it. Has everybody read it?
So I'll just say that the Family First Coronavirus Response Act really speaks to a variety of different options that people have, and that they have coronavirus leave options that they have not had in the past. So if you have any specific questions, I know that Kim is well versed at that. We have not had, to my knowledge at this point, we have not had anyone take that leave yet. Is that correct, Kim?
No, we have one that is
Okay.
utilizing some of that at this time.
Okay.
Okay. Any other questions, concerns? All right, then I would ask all in favor, please signify by saying aye.
Aye.
And all opposed, please signify by saying nay. Okay, so am I hearing abstentions or muted people?
Probably some muted people. I know that I had trouble coming off here a couple of times.
Okay, I got one yay for that, and that's it.
I was a yay if you didn't hear me.
I was, yeah.
Okay.
That was Jay.
Okay, then that motion passes too. All right. Well, we found a weak spot in the Google Meets. Awesome. Okay, so next up is consider approval of WASDA policy changes to 3510 Associated Student Body. I'd accept a motion to approve that.
So moved.
Second.
All right, moved and seconded. Any discussion on changes to this?
So this really is just saying that we have the right to charge everybody a fee, and that we also have the right to make exceptions for free and reduced lunch students?
That is correct, Rhonda.
Okay.
It's about providing the opportunity for us to waive.
Okay, great. Thank you.
That's actually a law at this point. That we do have to change the ASB so that our free and reduced students either get a free ASB card or a significantly reduced charge, as do their families to attend those events.
Right. I assumed that this was in response to that, but just
Yes.
double checking. Thank you.
Okay, anything else? All right, then, all in favor, please signify by saying aye.
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 Okay, there's 3. Motion passes. And lastly, consider approval of the board meeting calendar for next school year. I would accept a motion to approve that.
So moved.
Second.
Okay, moved and seconded. Any discussion about that?
My only discussion is that I haven't been able to get it to download. So, I mean, I'm happy to approve, but I can't tell you that I've actually seen the calendar. So I'll
Okay,
roll
well,
with it.
we can set it off till next meeting too. I don't think it's anything
Well,
that
I
must
think
be
if it
done
works for
tonight.
the majority, let's roll forward with it. I'm happy to make it work, and I assume it's just going to follow our regular schedule. I guess my question is there anything really different than what we've done in the past?
No, nothing's going.
Really, no,
Yeah.
there is
Okay.
not. We tried to minimize around holidays, but Debbie's done a great job. We do not have special sessions put in there, and we did not have a retreat this year. So maybe that's a follow-up conversation, Jeff, that you and I can have.
Yeah.
If you think that it would be of value, to have a variety of different things, especially as I feel confident that Dr. Chen is saying that things may open up a little bit more. So maybe that can come secondly to everyone, Rhonda. And of course, if you want to cancel any of those as we get going, that's fine.
Because I do want to state we're back to 2 a month, but we do have 2 in December, and we've never had 2 in December. So if you guys don't want that second one in December, just please say something and we can adjust that.
It's okay. We're not afraid to say something. We got we got some time before we get there. So
We can
Very
get
good.
it set, and then you guys can take them off as we go if you need to.
excellent. Okay. Any other discussion from anybody? Okay, then all in favor, please signify by saying aye.
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 Got it. Okay, that motion carries. So let's move to superintendent comments.
All right. I think Lisa is the one that is most, can you let them know that my audio is not working? It is ironic that the director of IT has the worst audio, I must say. It is ironic, Lisa, since I haven't heard your voice. So just a few things. I just wanted to thank Dr. Chen and reiterate the fact that we meet on a regular basis. He has been very clear with us, and I think that has been a benefit, even though his message hasn't been what I have wanted. When he had spoken with me last, he said, Creston, you're trying to game the system and get hybrid going before it's safe. And I appreciate him kind of naming that, but it sounds like perhaps we are looking at a different scenario. So with that, we do have our new teacher orientation coming up, as well as tomorrow morning, I speak with the FCC director from Washington DC, I'm sorry, with Susan Enfield from Highline. And then there's 3 other individuals throughout the nation, all women, speaking on the podcast in terms of connectivity. So when that comes out, I will send that to you. We just received some information about the CARES funding through Pierce County. Kim and I are going to have to navigate through exactly what I need to do in order to access that. But my question is always, is that in addition to the individual CARES money that we have gotten? I anticipate that it is, but until I see that in writing, I'm not going to trust it. I did send you some information on transportation, and Kim did speak about that. that has been a continued conversation and will come up in legislation. Pretty serious that we cannot lose our people that are CDL certified bus drivers and then lose them, because then we will never be able to be back to a situation where we can bring kids back. Of any of the employee groups, they worry me the most because most of them are either retired firefighters, sheriff. You know, we have these amazing people that have committed to Eatonville School District, and we cannot lose them. Kim has done an amazing job with the PSE, and I just want to commend her for that because she is just really quality. You know, one of the changes this year is to record attendance, and I think it's really going to be an interesting conversation. My daughter is also a teacher, and talking with her about what that's going to look like. We really need to reiterate the fact that attendance is important, and also at the same time giving grace and permission for families to be able to do what they need to do at this time, because it is difficult. We have a great remote learning. Travis did a wonderful presentation for Google Classroom. We do have a core 4. And if any of you are interested in the work that is being done around UDL, that's universal design, that is about equity and making sure that all students have access. And with that, I think that's everything that I wanted. The only thing I wanted to let you know is today I worked from home. I don't know if it was really working, but I was watching my 2-year-old granddaughter, and it was exhausting. And I really have a heart for all of these parents that are trying to do remote learning from home with their children and little children. We're really going to have to wrap around and figure out how we can support them, because it's really difficult. It's really, really difficult. And I am so exhausted. So I'm happy to go back to work face to face with adults, but I know that our teachers are really struggling with that, both with their own children at home, as well as how do you have, you know, regular habits, routines, and quality remote learning. So I am very looking forward to having some kind of hybrid if we have the opportunity to do that. So with that, I'm done. Thank you.
Okay. Lisa, do you have any comments you'd like to make? I guess not. Sorry, I couldn't resist. So board comments, anybody like to make some comments now?
So I'm good. I think that was a fantastic conversation there with Dr. Toon, and hopefully we get some positive movement forward now.
Absolutely.
Also, I am very grateful. Thank you for coordinating that, Preston, and inviting Dr. Chin to be there. Also, just Debbie, real quick, have we been sending messages out to our student board members since school's going to be starting? We're just thinking about how we're going to handle that and making sure they have
No,
a part of the
I need to
conversation.
do that this week. I need to get that information because I don't know that I got the full information for the new person. So I'll get in touch with Queenie and get all that information and make sure they have the calendar now that it's set, and I'll add them to the board meetings too.
Thank you very much.
Okay. Paulette, anything from you tonight? Okay. Nothing from Paulette. So I also would just say thank you to Dr. Chen for his time tonight. That was a lot of good information and real numbers to look at. And I would also just like to acknowledge the concerns of a lot of people in our community and the letters we've been getting about their petition for some social issues right now. And I'm really happy to say that that is work we've been working on for a long time. We'll continue to work on I was personally a little disappointed with the manner that came to us, but I look forward to some community involvement, which makes most things better in our school environment. So we've got a lot on our plate right now, but we will certainly get on that, get that up and running again when we are able and as we are able. So thank you to everybody for chiming in on that. Anybody have anything else to say? All right. Hearing nothing but stunned silence, let's adjourn this meeting at 8:20.
All
Thanks,
right.
Jeff.
Thank you all. Thank you all.
Thank you.
Good
Good night.
Good night, everyone.
Good
Night.
night. Good to see you all remotely.